Hi, I'm Rashad Hosseini, and this is the video from my project, which is about creating a simulation in order to find out more about the spreading of diseases. As I said, I've made a computer simulation in order to show the spreading of diseases, and but the problem was at first I thought, well, this is going to be an easy project, but as I went further, it started to get more complex, and it was getting harder and harder. Well, there was two reasons which kept me going, two motivations. Well, the first one was this project is really related to my favorite subject, which I'm going to study in university, which is computer science. Well, there's lots of programming in order to make this simulation, about 400 lines of code. And also, the second reason is, well, I'm about an age which I'm about to enter society as an adult, and also it's the first time for me using this knowledge that I've learned for the last 2 years, in fact, the last 12 years, to be helpful for others if I can. Well, I try to be helpful for others, and it is a great feeling which kept me really going through this project. Now let's see, how does the simulation actually work. Well, first off, we have some main variables which are really effective for our simulation. One of them is population, I mean the number of people in a population. The other one is number of initially infected people. For example, you can put it like 1% of people are initially infected, so they will spread the disease. Another one is number of people in gatherings. This is an important one. The other one, which is the main one I believe, is the chance of infection. When an infected person with a healthy person interact, what's the chance that the healthy person is gonna get infected? And also the mortality rate, which is obvious, and the duration of the disease. Well, here's a demonstration of how the simulation works. Here we have a population, and as you can see, the simulation will randomly choose a number of people, and then it will move them to a gathering. Gathering is where all the interactions happen. And what is the maths behind when a healthy person interact with an infected person? So here we have a decision tree, as we have learned in decision maths. As you can see, when they interact, there's a 10% chance that he will get infected, and there's a 90% chance that he does not get infected. This 10% is the number that I've talked about, the chance of infection, which is a variable, and we can change it to what number we want. And when he gets infected, when he or she gets infected, there's two outcomes. First one, he or she does not show any symptoms. As the research that I have done in the paper, I realized that about 50% of the people who are infected does not show any symptoms, and 50 of the other half show symptoms, and from the other half which show symptoms, they have a more critical health issues, and from them 80% of them live and 20% of them die. This is the number of mortality rate, which is a variable as well. Well, now let's talk about having symptoms or not having symptoms. Well, at first I thought not having symptoms is better because there is no chance of dying from not having any symptoms, but I decided to add one more feature to the simulation, which was self-isolation. As you can see, people who has the symptoms after 3 days, which this number is also variable and I can change it to what number I want, they will realize that they are sick, and a percentage of them will decide to self-isolate, and I decided to put a really high percentage for it, about 90%. So most of the people who know they're sick, they will self-isolate, but there are some people who doesn't. And as you can see here, people in the population who are sick, who know they are sick, will decide to self-isolate. Well, being in self-isolation has some good benefits. When the first one is these people who are in self-isolation, these are infected people, and they'll no longer be able to infect other people, which is a really good point. Well, as we must see that people with no symptoms, they are infected, but they don't know it, and they have the ability to infect others, which is really, really bad. So now let's talk about how I'm going to plot the data. Well, as you can see, I have a graph. In the graph, the x-axis will be days and the y-axis would be number of the people, and I will have three different graphs on the same axis. First one is going to be for the people who do not show the symptoms and show the symptoms. This is the largest one. This one, the second one, is going to be for the people who show the symptoms. It's a bit smaller, about 50%. And the smallest one is for the people who are dead. Now, how I'm going to compare the data is going to be by finding the number of maximum symptoms per day. Well, this is, if you see here, this is the maximum number of people who has the symptoms. And also I decided to measure the variance, and as we all know, we can find the variance by using this formula. So I had to write this formula in code, which was quite easy. Well, the last point that I want to talk about is having a variable chance of infection. Okay, what do I mean by that? Well, let me tell you by giving you an example. 2 weeks ago, the numbers for coronavirus in my country was really, really low. So people didn't really care about it anymore. They stopped wearing their masks. They started paying less attention to the social distancing rules, and as a result, this week the numbers reached the all-time high. So what I'm trying to do here is trying to have a variable chance of infection, and whenever the numbers for the coronavirus is decreasing, people will basically care less about this, so the chance will go higher, and whenever it's going higher, they start to care more about it again. So how it works is I'm going to be using the number of identified people. How do I get identified people? Well, the identified people are the people who have the symptoms and it's already 3 days past after the disease has started, so they already know that they have the disease. And also the other way is by doing daily tests. Basically we just randomly test some people, and if they're positive, we move them to self-isolation, so it's not a really huge thing. But here we can see a graph which is generated. I'm gonna see you the real generated graph as well in a moment. And what the rules that I've used, so when the data is used 5% of the population, people will start to notice, oh, there's a disease, and they start to care about it. So there's like a primary chance of infection, which is really high, because at first nobody knows there's a disease, about, I don't know, 20%. But when they reach a certain number, in this case I've put it to be 5%, people will start to care about it. And as they go on, they will reach their first peak. Now, as you can see, after the first peak, the data will start to decrease. But as I said, when the data is decreasing, people will start to care less about the disease. So the chance of infection rises again. And as a result, we can see there's another peak. And it's coming down, and there's another peak. And it really slows down the process of getting rid of this virus. Well, here I'm gonna show you a demonstration of the simulation. Here you can see all these numbers, or all the variables effective in the simulation, and if we run the simulation, we can see, give it a few moments, and any moment, yeah. Here's the graph that is produced. As you can see, there are so many different peaks. There's one here, and then starts to have another one here, but then slowly but surely gets down. If you want to try this without a changing chance of infection, it's going to be something like this. I'm going to show you right now. Okay. As we can see here is a really nice bell-shaped curve, which in my opinion is not really realistic. I just wanted to say, for the last 2 weeks I've been spending 6 to 7 hours a day on this project, and I'm finally really glad that it has a great outcome, which I really am happy with. And also I'm really glad that by the knowledge that I've learned for the last few years, I'm able to at least maybe help others to get one step closer to solve this world pandemic. Thank you very much.